There's so many people out there suffering from pain. They don't know what to do. They don't know who to turn to. And their doctors are pulling them off medications. We want to show people that there are many different ways to successfully manage their pain without opioids. And these are real patients. This is an important series. It's important to show those personal experiences that a person has in really transforming their health, their lives, their families.
But when I was 12 years old, I woke up one morning and I wasn't able to open my mouth.
I took a fall when I was 12 and I busted my coccyx. It was never repaired.
I had 8 major surgeries on my face.
If I'd known my life was going to be like this at 65, I'd have probably killed myself at 63.
My pain mostly deals with the fact that I've had an onset at an early age. I woke up unable to open my mouth, and so down the line I've had to deal with surgeries because of that. So I deal with pain that's both post-op and dysfunction. I virtually have the joint of an 80 to 90-year-old person because of so much wear and tear in my joint. And the pain is constant. It definitely goes up and down with usage. So talking is definitely gonna cause me to be laid up for a few days. That means I'm in bed for a week trying to come back from all the talking or running around and being busy. So I've got such a thoughtful husband who allows me to put family first, and it's not about money, it's not about anything other than me having a life outside of our house.
I am probably the most emotional person in Brianna's life, for better or worse. So I think sometimes I might wear what's going on my sleeve a lot more readily than she does. It's been tough at times.
Well, Brianna's pain has pretty much defined our whole lives. The toll that it has taken on her and all of us is immense. It is difficult every minute.
As a chronic pain patient, I've definitely dealt with opiates in my life, and I do to this day. As the TMJ issues increased, I had to depend a little bit more on narcotics and opiates. And I am also aware that I come from a family where alcoholism is involved. So I know that addiction is in my family, so I have to be aware of that as well. Sorry, hold on. Oh, let's just get it done. I'm a little Charlie horse.
Stretch it a little bit. A little bit of stretching.
Yeah. Are we close? Yeah, we're almost done.
Yeah, we're just have a couple more rounds.
Yeah.
I'm a comedian. I tell jokes, and I'm not Jewish. I've had problems with weight since I was young, probably since I was around 12, 13 years old. Well, I've been living in constant and chronic pain probably for 25 years. Started with back pain and sciatic nerve after that, and then later developed into joint pain. I have arthritis now in every bone in my body, and it's in my spinal cord from my neck to my tailbone. So, I am taking pain medications. I'm on an antidepressant, like everyone else in America. I've tried to battle taking drugs from my doctor as long as I could, because I've had friends die from alcoholism and drug addiction. I locked myself into my bedroom and I stayed there for nearly a year. There are days, though, when I feel like 911 better get here. And there's a lot of times when I wake up in the morning and I go, shit, I woke up again. Yeah, that happens a lot.
Okay, I was an EMS worker for 17 years. I have degenerative osteoarthritis. Yes, my major pain is in the neck. The other pain problems that I have are my hips, and just had surgery on my right hip. In 2006, when I started with my pain, they thought, well, we'll just try the Vicodin and see how it goes. Well, the worst part about being on them is that you just didn't know. You didn't know from day to day like, oh God, did I take too many? Didn't I take enough? Finally, we've hit on a medication that just stopped or helped everything, the spasms, everything, and we're making it work, and that medicine happened to be Dilaudid. Oh yeah, that's morphine. There was so much addiction in my family with alcohol being the main one, but that was the big one, and it scared me. And I wasn't being a good mom to my son, and so I needed to be there for him, and in order to do that, I had to take the pain medication.
It's important to realize that not every story is a success story. It's a challenge to get off opioids and manage your pain. But with a comprehensive approach provided to these patients and to work with their family and friends and their doctor to really help them manage the pain and have a better chance of success. And this series on pain and addiction will help provide an example to people throughout the world on how to do that.
Having people around you, it really helps you kind of take yourself out of your own head. And when you're stuck in your own head, that's a bit of a trap. Actually, they have helped me more than any antidepressant could ever help me. They allow me to get an energy that I never knew I could have. Physical therapy has been a huge help with my posture, as well as making sure that I know what my jaw needs. Heating, icing, stretching, or just relaxing. Presently, my goal is I'm tapering down to get off for a period of time, at least, just to kind of see where I'm at without the medications.
The best way I learned to control my pain through Dr. Frickton was all the tools he gave me as to how to sit, how to relax, how to, what I should eat, what I shouldn't eat. All these different wonderful things that have really been helpful. So I don't have to take any pain medicine at all. No opiates, nothing. Then I've just learned how to eat differently, how to make myself relax. Positive attitude is a wonderful thing to have. You have to do it. I mean, I am no longer on any pain meds at all.
I just try to deal with it every day, you know, I mean, do what I can. Well, the things I can try to do to help alleviate the pain is, sometimes it's hard. It's hard. You just want to stay in bed all day. I realize you can't do that. You've got to try and move. I don't like to project, as far as remaining positive, I don't like to project my negative on people. You know, I'd rather, in my life, I've always loved making people laugh as a kid. So if I have a chance to be with people, I want to entertain. You know, it's the times when there's no one there that it's tough.